We're here today with Dr. Friedlander, and congratulations once again on being named a top 25 leading women entrepreneur.
Thank you very much.
And we'd like for you to share a little bit about who you are and what services your company provides.
Okay. Well, my name is Dr. Beverly Friedlander, and I'm a plastic surgeon. I have been practicing the art of plastic surgery for over 25 years now, and my office is located in Short Hills, New Jersey. I like to consider my practice a boutique practice in that I offer very personal and individualized services to my patients. We have an in-depth discussion about what they are interested in improving upon, and I offer very individualized suggestions as to what products or services that my practice could offer to help achieve those end results. And what I find is that by doing that, I am able to empower women to feel the very best that they can. And when they feel good about themselves, they are able to interact differently with the world around them.
Absolutely. You're building a whole set of new confidence platform. So I was really impressed with reading through your application and learning more about some of the non-invasive products that you offer. Mm-hmm. And perhaps you can just tell us a little bit, because I think when people hear plastic surgery, they think, oh, this is all, it's surgery. Mm-hmm. But that's not really the case.
No, that's absolutely correct. Plastic surgery entails a number of different, I'm going to call them specialties for lack of a better term. The trends today are towards non-invasive procedures, and these are procedures that can achieve significant improvement in the appearance without the need for surgery. And it's important when you consider these non-invasive procedures to consider a physician who has extensive experience in them, such as a plastic surgeon, rather than potentially going to someone who is less experienced, for example, a general practitioner who's offering these services. That being said, what the services do essentially is provide an improvement in certain areas, primarily the face, but also within the body, that are starting to show signs of aging or even of change. For example, one of the things that I like to work on is what we call the glabellar area, which is the area between the eyebrows. Many times we develop furrows or wrinkles within that area, which give the appearance of fatigue or even of anger.
Yeah.
Well, we are a population looking for instant gratification, and we basically have 10 seconds to make an impression on someone. So if I'm interacting with someone possibly at a job interview or doing a presentation, if someone sees that I look angry or tired, they may perceive that I am not able to focus 100% on their needs or on what I'm doing. So a little bit of Botox right within that area helps to improve that region, provide a much softer facial appearance, and it allows people to relate more directly, because they feel as if I am focusing on them rather than on my fatigue or my anger.
Absolutely.
Much like the other procedures that I do, the non-invasives, the fillers, I'm able to soften lines which give the appearance of having an older or an aged appearance. And by softening these lines, I create a much more youthful appearance, and now someone thinks that I am more timely, that I'm more on par with what is going on. Mm-hmm. So the non-invasive procedures are procedures that give instantaneous improvement, that do not require any downtime, which is so crucial in today's environment. Mm-hmm. We need to be able to go back to our activities immediately, whether that activity is family-related, job-related, or even social. We want to look good, and we don't want to take the time that surgery requires to recover from. Mm-hmm. So the non-invasives will provide significant improvement without the downtime, without the bruising, without the other stigma of having had surgery, no scars, no incisions, and we get the improvement in our appearance.
It sounds like you get good results and a nice solution.
Absolutely.
So we're going to move on to part of being named a top 25 is focused on how we give back as leaders in the community. Is there areas that you'd like to share with us with advocating for women or nonprofits that you're involved in?
Well, actually both. Now, I said that I've been doing this for 25 years, which is kind of interesting. I've been practicing since the late 80s. Well, early in the 1990s, breast reconstruction had become much more common, and even back then it was not as common as it was now. And I remember back in the 90s that there were issues with insurance coverage for breast reconstruction. So I went to Washington with a large group of plastic surgeons, and I advocated for breast reconstruction. And as a result of that effort, we were able to ensure that the government passed legislation that all insurance carriers were required to cover breast reconstruction, and that's all aspects of breast reconstruction.
Wow, I mean, you're a pioneer in that.
In that regard, yes. Yeah, in that regard.
Unbelievable. I mean, you've definitely affected so many lives with that.
And that is what I like to think about my practice, the fact that I am not doing anything for vanity. I am doing this to make people feel good about themselves and sometimes even to feel whole again. And breast reconstruction now is a small part of my practice. It used to be a very large part of my practice, but it is one of the most rewarding things that I do.
Absolutely. So the theme of today's event is Unleashing Your Power. Is there a moment that you could share with us that you felt you have unleashed your power in either a professional or a personal way?
It's a very difficult question to answer. And offhand, I can't think of one event specifically. I think that on a daily basis, however, I am able to do that. And when patients come into my office after they've been treated and they give me that hug and that kiss, that's when I know that, in fact, I have unleashed my power and I have done something that has been life-changing for that individual. So an isolated event, no. An ongoing event, absolutely.
Well, I couldn't agree with you more. You're changing lives every day, and I commend you and congratulate you again. Thank you so much for being a part of this.
And thank you very much as well.